Hey folks, Jack Spirko here. I wanted to talk to you about the Swedish model, and I want to talk to you about the cognitive dissonance in people's heads that continues with them telling you how bad Sweden did and how it's horrible in Sweden. People are dropping over like flies, and boy, we're lucky we didn't do what Sweden did. And things are so much better in the United States than they are in Sweden. You know, even adjusted for population, there's about 10 million people in Sweden. There's about 330 million people here. So, of course, we have bigger numbers, but percentage-wise and the way the curve works and all, Sweden's model is just terrible. And my God, the world would end if we did that here. Well, bluntly, the data is in, the pattern is set, and it is no longer a debate whether or not the Swedish gamble paid off. The answer is it did pay off. We should have done what they did. They made one big mistake. We did the same thing in some states because we have some stupid governors who probably should be inside a prison cell. I'm looking at you, Como. Before I go into this, I want to explain the big mistake Sweden made and the fact that they've corrected for it and how everything I'm going to show you right now, and this is all publicly available data. This is the data from the vaulted experts we're supposed to listen to. Might be nice if they listen to their own data. You can verify everything I'm about to show you here. Okay? But Sweden's big mistake was they did not close access to elder care facilities, dementia facilities, nursing homes, elder care, assisted living, all that. They didn't do that, and they should have. Now, Sweden has something that I've never seen anywhere else before. Politicians and bureaucrats that when they make a mistake, they come out and say, we made a mistake, we fixed the mistake, we're not going to do that again, it's our fault, and people died because we screwed up. They've come out, and the epidemiologists in Sweden that have made this decision to go forward the way they have come out and said that. We screwed up. This is our mistake. People died because we screwed up. Don't do what we did with this, and they fixed it. God, I wish we were able to do it. Instead, what we have is Como here defending his decision, not only to not lock down elder care facilities while he locked people in their homes, but to mandate these elder care facilities take positively tested COVID patients into their facility. That made our death rate worse, specifically New York, New Jersey, Pennsylvania, which affected the entire country because New York and New Jersey have some of the highest rates overall. So you take those out, and everything I'm going to show you looks better, and it still looks the same between the two countries. So let's start off. This is the IHME modeling website, and this is for Sweden. They've changed this site recently because, honestly, their old method of producing these projections was really easy to interpret. And so when even a layman looked at it, it was obviously an embarrassment to them that they got everything wrong and continued to get it wrong. This is the daily infections and testing rate. This right here, this blue line that's solid, this is the number of tests that were done and how many tests they think will be done. I think Sweden's going to keep doing more and more tests going out. That's their projection. They're projecting tests. Good job, guys, to project tests. I'm sure the country can just tell you how many tests they plan to do. This is estimated infections, this dotted line. What this is saying, because this is way back here on April 12th. So why are you estimating infections on April 12th? Because they're estimating the number of infections. The newly infected on April 12th is estimated at 7,449 infections. But you see confirmed infections down there at 514. That's what people like me have been telling you forever, and they're finally admitting it, but they're not talking about it. They're putting the data up, but they're not reporting it, and they're still giving you a death rate of like 2.7%, but they're not basing it on this number right here. They're not basing it on estimated infections. They're basing it on confirmed infections. So they're giving you a death rate based on saying, well, on this day there were 500 infections, but they're really saying there were 8,000. This is what I'm saying. Even IHME is now saying that the denominator is somewhere between 5 and 10 times larger, and I still think that's conservative. This orange line down here, this is Sweden's actual new daily infections right here. Now, if we go to confirmed infections, you can see that that looks a lot more dramatic. This is also a lie, right? And I'm going to show you that it's a lie. IHME is cooking the books on their numbers, and they're also showing you confirmed numbers as of May 10th. It's May 20th. I don't know, dude. Maybe you guys at IHME need to wake up and get your guys to work and update this a little more frequently. This data is 10 days old right now. So it's much more interesting to look at the estimated infection rate. And you can see that now we're here on, May 20th. So we're way out here. And they're saying there's an estimated 4,200 new cases in Sweden today. Most of them are people that will never even know they were infected because they're among the 90% plus that are asymptomatic the entire time they have it. That's what there's. I'm not saying that. You go look at the number of actual cases today. We can do that in a second. And it sure as hell ain't 4,200. That's where that number's coming from. And they're showing that number just decline. Like July 1st, you're down to 477. That's estimated. That's your 6 to 10x number. That's not how many people they say are going to test positive. And it just declines from there and dwindles off to almost nothing. That's their new model. They changed the old way they were reporting this. You'll have to take, I never took screenshots, but what you had is back here where you had the curve coming up, you had this giant cloud of death and infection out here. Actually right about here. And then we started to get closer to it. It was clear it wasn't going to happen, so they moved it to here. And then we started to get clear, and so they moved it to here, and eventually they had it out in June. Just a couple weeks ago, they had this giant death cloud out here in June. They finally took it away when they accepted the fact it's not coming. Here's your deaths. It's the same thing. They had a giant cloud of death out here in June. It's gone now. Even IHME looked at it and took it away. They got rid of it because they are embarrassed by it. Okay? And if you look here, this is one of the things that people are using to make a case. See how Sweden is this, for those of you that don't know a map without the words written on it for you, that's where Sweden actually is located. And you're seeing that they have this really dark, scary orange color, the same color as not quite the same color as Belgium. Belgium's got even a darker, more deadly color, as does Italy. This is based on per capita. So they're saying, well, look at Sweden. Sweden compared to its neighbors of Norway and Finland. Again, people that aren't familiar with the globe, that's where Norway and Finland are. This is a disingenuous comparison. These three countries are fairly similar in land area. They have about roughly similar land area. It's not the same, but it's close. Sweden has about 10 million people, and Norway and Finland both have about 5 million people. Their population density is about half. And neither Finland nor Norway have anything approaching the population density of Stockholm, Sweden. So you have a much greater population density. And so it would be like comparing Dallas-Fort Worth to New York City. Dallas-Fort Worth is the metro area I live in. We have about 7.6 million people. And we have about 9,400 square miles with that 7 million plus people in it. And we have had nothing approaching the draconian lockdown that New York City did. And we have a fraction of the cases in the state of Texas that New York City has in the city itself. So when you throw in huge cities like Houston, San Antonio, and Austin, plus Dallas-Fort Worth, we are tiny compared to just New York City. But we're spread out. By the way, 66% of the new cases over the past month in New York City were people that stayed home. Not just people that didn't have a job, people that never left their house disproportionately got the virus because it's a function of population density. Now, how do we know Sweden's right in the way they did things? Now remember, they screwed up. They screwed up when they let people go into the elder care facilities, just like our governors in Pennsylvania and New Jersey and New York screwed up when they sent sick people into there, and we did it way worse. Sweden admits their mistake, we defend ours. But this is the daily new cases in Sweden. And you can see it kind of pops up and down. I like to believe there's a guy named Claude in Sweden, and he's not real big on entering numbers, and sometimes he enters all the stuff on the same day or something, but in the end, you can see the macro curve, boom. Here's your peak right here. Right in there. There's your median of your peak. And then you can see your curve go down. You can see that all this shit started in Sweden around March 2nd. Let's look at their death rate, because death is what it's really all about, right? Total deaths are scary. Because we have a line, it's a of course it's always going to get bigger. It's cumulative. If we look at the daily death count, That big giant cloud of the peak death rate they pushed all the way out into June actually occurred right here on April 21st. Now, you have a few days where Claude was a little slow on the uptake. He only entered 5 on this day, so he had to make up for it by entering 147 on this day. But in the end, you see the macro curve is right here. Right here. That's it. They've been through their peak death rate, and they've been through their peak case rate. They're not going to have it come back with some big giant second wave after this curve does this, because they're not coming out of lockdown because they never went in. How drastically different is this from the United States? Can you really see a big difference? See, daily new cases. Can you? Or does it look, does it look very similar? It looks very similar. Now, we started a little bit later. We haven't had quite this real terminal drop yet because we're not all the way through it. We're also a much bigger country with a lot of different geographic regions that started at different times. You can't compare the United States to Germany or Sweden, or you can't compare it to any of these countries because we have a much bigger population and we have a federalist system where things are spread out and different in the timing. But you still see a very similar pattern. And you guys that are freaking out, the United States is in a complete, very clear decline. Places where you're seeing more cases, but it's not a lot more, it's just a little more, it's concerning. That's because we're testing like way more. In Texas, for instance, we've tested more people in the last 2 weeks than we tested in the previous 8. So you're going to find some more cases because, again, you need to really get this through your head, some of y'all. You really do. The number that you're hearing is not the real number. If we look back again, these are actual cases in Sweden versus the estimated infections. So on a day that they reported 514 cases, IHME is saying there was really 7,400. That's about 12 times? 13 times the number? See, I'm not a crazy redneck duck farmer after all. I'm a redneck duck farmer, but I know what I'm talking about. I can do math. I didn't learn Common Core like you young folks. This is basic, easy to understand mathematics here. The curve's already happened. Sweden's right. We were wrong. Can't we learn from this? Can't we learn from this? Let's look at the death rate in the United States and Sweden. I'm going to show you something that's kind of odd. Almost makes you wonder if we both have Claudes that like put off their work and double down on certain days or something. So where's the United States' peak daily death rate? Where did the United States peak in the most deaths we had through this whole thing? There it is on April the 21st. On April the 21st, the United States had its peak death rate, and even though it climbed back up a couple places here, this is when New York City backed a bunch of people in and called people that were already dead for a couple of weeks COVID deaths, even though they weren't, even though doctors had already signed up on the death certificate. But let's even let that go. We peaked on April the 21st, and the macro curve is down. Okay? Look at Sweden's death rate. They got a lot more ping pong up and down, but the macro curve looks very similar. When is their peak death day? April 21st. We had our peak daily death on the same day Sweden did. They did not destroy their economy, and we did. Our curve, again, of new cases looks dramatically the same. Dramatically the same. You give us another week, we're going to have more of this pronounced drop that Sweden's having, and we're going to pretty much be through this because we didn't do very much to flatten the curve because we did all the heroic measures we did, wrecked our economy, destroyed countless businesses, printed stupid amounts of money, and this is Sweden, and this is the United States. And this is Sweden, and and all the special children want to get angry at this. You can't, this is not my opinion. This is data from the people that you're trusting to tell you to wear a mask when you're driving a car or going to the beach. This is the same people that are providing this data. They're just not listening to their own data. You have to stop. See, the United States, let's look at the United States here. This has gotten a lot slower, unfortunately. I don't know, maybe we won't do it. Okay, so that's individual states. United States of America. I want you to understand that when I tell you that the infection rate is far higher and therefore the death rate and hospitalization rate is tiny, I'm not making these numbers up. Let's look on this day right here, April the 10th, 2020. There were confirmed 31,556 infections in the whole country. The estimated infections from IHME, 214,887. That's not the cumulative total number in the whole country. That's how many they say there were on that day. 31,000 reported, 214,000 actually there. Take those ratios. Do the math yourself and see what happens to your death rate and your hospital rate. And what you end up with is a hospital rate of about 1 to 2% and a death rate somewhere under 0.5%. That doesn't mean it's not a problem. It doesn't mean it's not something to do anything at all about. It doesn't mean we can't do basic, because Sweden did social distancing. If I go back to Sweden, you can see that the mobility and the interaction is, this is normal, right? Up here, this line, and this is where they are. This is where IHME says they are. But they only put one restriction in, large gatherings. That's the only thing they did. They did not do a stay-at-home order. They did not close educational facilities. They did not tell any business that they had to close. They did not close all non-essential businesses. They did not severely limit travel. The only thing that's not on here that they did is they closed bar top service where people are real close to each other in bars and restaurants and said you got to sit at a table and space yourself out. Otherwise, life is pretty normal in Sweden. And we ended up pretty much in the same place except for their economy's not destroyed and ours is. It is time to stop buying into this. Again, it doesn't mean there's nothing. It doesn't mean that I don't care about the people that lost loved ones. I think that the governors of New Jersey and New York at least, and maybe Pennsylvania, though there might be a lower level person there that can really be the one that did it, should go to prison for the deaths of these elderly people for being that maliciously wrong, that incompetent. That is reckless homicide in the thousands, or at least manslaughter, careless, foolish actions that you should not have taken. Those were, and they won't even admit that it was a mistake. But Como issued an executive order saying if your grandma had COVID-19, that not only was she to be sent back to her elder care facility, they had to take her. And that's a big, huge part of the number of people we lost. There's thousands that we lost because of that. We made that mistake. Sweden made that mistake. They admitted it. They corrected it. We deny it even though we have corrected it at this point as far as I know. But I'm going to tell you, it is time to stop buying into this, and it's time to start calm, sensible civil disobedience en masse. It is time to do that. It is time to move on with our lives and accept some people are going to get sick and some people are going to die, and that sucks. But locking people up didn't change it. You can say it did. And I know you're highly vested in this now, and you want to believe it, but when they told you they were controlling it and they showed you this, on a day when you were having 20,000 infections, they say you were actually having 250,000. And the majority of people that ended up in this number here, in this thing, and ended up in hospitals and sick and dying, stayed home. I want you to just think about this for a second. If you're, my age, I'm almost 50. Then your grandparents lived through the Great Depression and World War II. And we have newscasters trying to convince you that you are the new World War II generation, the new Great Depression generation, that's sitting at home, ordering your food from the magic truck that brings it to your house, and not going outside and binge watching Netflix puts you on par with those people. If my grandfather was around right now, he would be walking around outside looking for people being scared and kicking their ass. I'm telling you, these people lived through polio. They lived through smallpox. They lived through measles with no vaccine for decades. And they never shut down their economy. Smallpox and polio. They did what they could and they went on with their lives. And we have destroyed the economy of the greatest country in the world for a virus that has a lethality rate of under 0.5%, and we know the population most at risk, and we could have protected those people far better than we did without destroying everything. But instead, what the media does is drags a few young people that died, almost all with immense amounts of underlying comorbidities, and tell you it could get your child and scare you to living in your toilet paper for it. It's time to come out of the toilet paper for it, folks. It really is. It's time to stand up, and it's time to accept this is reality. This is what happens. Diseases come and diseases go. This is not one to hide under your bed from. It's one to be smart about, but it is time to put this place back to work. Sweden never shut it down, and it doesn't look any different. You can be mad at me. And what's happened is people are so vested in this now, they can't believe this was a mistake. They can't accept this was a mistake. They can't admit this was a mistake. It was. It absolutely was.